All right, we are not going to get too crazy on getting into detail with the disorders. We're going to divide it up into upper GI and gastric disorders, liver and pancreas disorders, and lower GI disorders. And then we're going to briefly talk about nutrition and the nutrition for healing or recovery from an orthopedic injury. So, and in the nutrition part, we'll talk a little bit about popular fad diets, always a fun subject, always fraught with opinions. Um, but like I said, we're not going to get too crazy. We're going to try to keep it brief. So hold me to that, okay? If I start talking too much, just stop me. So dysphagia is a really common thing that we encounter in physical therapy for a lot of different reasons. So we want to talk about the common causes of dysphagia, which is difficulty swallowing. We want to look at acute and chronic gastritis. So gastric is the stomach and itis is inflammation, acute versus chronic. Gastroenteritis, which is more of the gastrointestinal system. The etiology, signs, and possible complications of peptic ulcers and gastric cancer. So pretty simple, I hope. So dysphagia is difficulty swallowing for any reason. There are a lot of neurological causes for dysphagia. It can also be caused by a muscular disorder because the muscles that we use to swallow are muscles just like any other muscles. They just have a specialized function. Mechanical obstruction can also cause dysphagia, and we've all sort of heard about that in CPR class for the Heimlich maneuver. The presentation is sometimes pain with swallowing or inability to swallow large pieces of solid material or difficulty swallowing liquids. So in a lot of settings, we work closely with speech therapists, and they deal a lot with swallowing issues. So you'll go into, like, say you're working in a hospital, you're working in a skilled nursing facility, you'll go into somebody's room and there'll be instructions from the speech therapist up there, things like sit upright and tuck chin when swallowing. Some people might need to have mechanically processed food or thickened liquids in order to swallow safely without aspirating. So lots of different things. You can see the neurological causes can cause dysphagia. Infection, stroke, brain damage. I'm struggling with pronouncing that word right now. But it's failure of the lower esophageal sphincter to relax because of lack of innervation. So it's a muscular issue, basically. Impairment from muscular dystrophy can also cause the muscular / neurological causes of dysphagia. So lots of things can cause it. You see it a lot in people after a stroke or after a brain injury. So mechanical obstruction, there's a congenital developmental anomaly that's called atresia that causes a mechanical obstruction of the esophagus. You can get stenosis, narrowing of the esophagus for various reasons. You can have esophageal diverticula, which are the little pockets that form in the esophagus, and those can get irritated and infected as well. Or tumors can cause mechanical obstruction dysphagia. So obviously they're really serious and they need some surgical and sometimes other types of intervention. So very difficult to deal with. Gastritis is itis, it's inflammation. When the gastric mucosa is inflamed, it also may be ulcerated and bleeding. So lots of things can cause acute gastritis, infection, food allergies, irritating foods, excessive alcohol intake, NSAIDs, corrosive or toxic substances, radiation or chemotherapy. The basic sign is gastrointestinal irritation, and acute gastritis is usually self-limiting. Chronic gastritis tends to go on. So usually the treatment for acute gastritis is just symptomatic treatment and remove the irritating substance if that's the cause. For chronic gastritis, you actually get atrophy of the stomach mucosa and loss of secretory glands, And so you get reduced production of intrinsic factor, and that can cause pernicious anemia. So lots of more complications possible with chronic gastritis. Helicobacter pylori is the bacterium that causes stomach ulcers, and it's often present in the case of chronic gastritis. So like we've talked about a lot of acute versus chronic things. A lot of the acute symptoms are very immediate and sudden onset. With chronic things, the signs can be vague, like mild epigastric discomfort, anorexia, intolerance of certain foods. So with chronic gastritis, you do have an increased risk of ulcers and gastric carcinoma because you get those the atrophy, you get the changes in the mucosal cells, and that's where the once you start changing cells, stuff gets crazy. It could turn into cancer. Certain autoimmune disorders are associated with one type of chronic gastric atrophy, but there are other things that can cause it as well. Gastroenteritis, well, now we're getting the intestine in on the things. So not only is the stomach inflamed, but the intestine is also. And gastroenteritis is usually caused by an infection or an allergic reaction to certain food or drugs. So a lot of times it's infection with microbes that are transmitted by fecally contaminated food, soil, and or water. Most infections are self-limiting. So like an E. coli infection usually results in gastroenteritis. Serious illness can result in a compromised host, immune compromised, or with really super virulent organisms. It can cause epidemic outbreaks in refugee or disaster settings because if it's contaminated food, soil, or water, there could be a lot of people involved. Safe sanitation is really important for prevention of gastroenteritis. So lots of common infections transmitted by food and water. I don't expect you to memorize these, but just know that there are a lot of them. And a lot of times we hear about it. Like sometimes you'll see food recalls and they'll say food was recalled because of listeria infection or listeria contamination is what it is with food. So lots of different things can cause gastroenteritis. And a lot of them are food and waterborne. So gastric and duodenal ulcers are usually caused by Helicobacter pylori infection. And it breaks down the mucosal barrier, so you have decreased mucosal defense. It predisposes you to the development of ulcers. And it's the damage to the mucosal barrier is associated with inadequate blood supply caused by vasoconstriction. So lots of different things can cause vasoconstriction. And it interferes with that rapid regeneration that needs to happen. Because remember, those cells have, they're very mitotically active because they're getting sloughed off all the time. And you have to, so if you have vasoconstriction caused by stress, smoking, shock, circulatory impairment, scar tissue anemia, that can interfere with your mucosal barrier regenerating itself. Excessive glucocorticoid secretion or medication. So people that have adrenal problems can end up with ulcers. Ulcerogenic substances that break down the mucosal layer, aspirin, NSAIDs, and alcohol, or atrophy of the gastric mucosa from chronic gastritis. So lots of things can cause ulcers. The complications can be hemorrhaging, caused by erosion of blood vessels, and that's a common complication, and that's where you get like coffee ground emesis sometimes. It might be the first sign of a peptic ulcer, or even just that bright red blood. Perforation of the gastrointestinal tract, the ulcer erodes completely through the wall, and then that's a problem because then the chyme can enter the peritoneal cavity and you can get chemical peritonitis, and that can kill you. That's pretty serious. Obstruction can result gastric obstruction because of the formation of scar tissue from an ulcer. So it's pretty serious complications, really. The signs and symptoms are usually epigastric burning or localized pain, usually following stomach emptying. So they'll do fiber optic endoscopy where they take the tube down your esophagus, a barium X-ray sometimes, so you swallow the barium and the X-ray shows the contrast, or an endoscopic biopsy, which is done in conjunction with the endoscopy. It's the Helicobacter pylori is treated with a combination of an antimicrobial that's specific for that bacteria and proton pump inhibitor to decrease the acidity, and by reducing exacerbating factors. So if something makes it worse, don't do that thing, like alcohol or certain foods. Stress ulcers can sometimes be associated with severe trauma or systemic problems like burns or head injuries, or hemorrhage or sepsis. That's usually rapid onset of multiple ulcers, usually gastric, that form within hours of a precipitating event. And the first indicator is hemorrhage or severe pain. And this is a photograph from the book of multiple ulcers. Not nice. Gastric cancer usually is in the mucus glands, mostly in the antrum or pyloric area of the stomach. So early carcinomas are usually confined to the mucosa and the submucosa. Later stages involve the muscular layers and eventually invades the serosa and spreads to the lymph nodes. So obviously you want to catch it in the earlier stages if you can't, but the problem is it's asymptomatic often in the early stages. And so the prognosis is usually poor on diagnosis because it's not caught in the early stages. It's not caught till the later stages. And that's the case with a lot of digestive system cancers. So diet seems to be a key factor, particularly not eating smoked foods like smoked herring or whatever, whatever smoked food you eat, and foods that have nitrites or nitrates in them. And genetic influences also seem to play a role, which makes sense since cancer is a disease of the genes. Usually the symptoms are vague until the cancer is advanced, and that is why it is not diagnosed until you get into the later stages. So it's usually treated with surgery and chemotherapy together and sometimes radiation to relieve the symptoms, but really low survival rate compared to other cancers. And that's because of the late diagnosis.